in the interest of time, what I'm going to do now is give the reflections from my side on the third issue, population movement, as well as the fourth issue, which is just kind of all the other things that we couldn't fit into these 4 papers in a huge amount of detail. And then we'll go through another round of our panelists with as brief a comments as they can fit in, which I recognize is hard because they have such a wealth of experience. So to jump right into it, on population movement, I think people are constantly on the move. Your livelihood, as Fernando was just saying, is most likely not in your home. And if you live in an urban area, you have to travel to work. You make short, regular trips to the market, to local stores, to specialty stores located in different places. You have friends and relatives dotted around the city. And also, particularly, as was the case in this region of West Africa, you have social connections and economic connections that go from urban to rural environments and other urban environments, and really to be an urban dweller is to be someone on the move. And so population movement is without a doubt an aspect of urban responses. And for the Ebola responses, as a comment from Philippe came in, pointed out that he'd forgotten to mention that the implication of this movement is that the virus can spread along with you as people move. And so a lot of the efforts were to stop this movement, which perhaps seems like a kind of a logical thing. People increase transmission when they move around, so let's stop them moving around. And a lot actually of the control measures which were then put in place to try and stop this ended up having unintended consequences of increasing untraceable movements, because if people really wanted to get somewhere, they'd find a way to do so. They'd find a pathway or a route or a way to bribe someone or whatever they needed to do to get there. And I think this comes down to this point again around kind of engagement and communication, and a lot of the stuff that Rania was talking about in her first comments, as well as a question that's just come in from someone who is asking basically, considering the difficulty of getting to everyone, even with the basic needs in an urban environment, which led to so many people breaking quarantine, how effective is that really as a tool? And I think it's the same question for how effective are these kind of efforts to stop movement. And the point we tried to make in the paper is that it's there are limits, and as many things as you put in place, you won't be able to stop everyone. And so that really emphasizes the importance of those kind of communication and engagement measures, because the few examples I read about of a more kind of community-led approach to monitoring movement, where areas would be able to monitor admission of people as they arrived into their area because they were informed of what risk they held. I think something that I wish we could have built more on, although that does raise questions about how possible that sort of thing is in an urban environment with all that density. And the last thing I wanted to mention about population movement is just the kind of missed opportunity of using data about movement from other sorts of sources. If you can't stop movement, it's at least useful to know where people are going. And there's a piece in the paper on population movement about the kind of missed opportunity of using call detail record data. And the message there is really around the need to prepare, because ultimately it wasn't possible to use this data in the response because there was no agreement in place, and then there were too many kinks to kind of figure out live. So the message there is around kind of putting these sorts of things in place, because in any response, population movement is going to be an issue, whether it's a health crisis like this where the movement really spreads the transmission, or in conflict situations, or even sudden onset disasters, population movement is going to be a factor. And so the last thing from me is just these other urban issues that came up. So one of them is around pre-existing vulnerabilities. In all 3 affected countries, the healthcare infrastructure and staffing and system really had a significant impact on the outbreak and the response. The concentration of facilities in urban areas meant increased movement of infected people who had to travel to seek care, and also the lack of infrastructure and staffing was a barrier to many receiving healthcare before, during, and after the response. And this low health capacity really limited the response, especially in the early stages. And another issue is rumors and misinformation which I think we covered a bit in under communication, but really is to point out that, you know, in a vacuum of effective communication, the knowledge gap will be filled by rumors and misinformation, and just kind of paying attention to that. And the last thing I wanted to mention, because it relates as well to new work that ALNAP is doing around this, is really the importance of understanding context. And this is as well what Philippe had mentioned in his opening comment. It's about the need to understand the context, the culture, and how that would affect the response. And I think that with some exceptions, the example of anthropologists being brought in, this was a bit of a gap, particularly efforts to understand perhaps the politics and governance issues, as well as the population movements and the drivers of that movement that really related back to social and cultural and economic reasons. And I think this gap is partly a result of painting the crisis kind of exclusively as a public health issue, and perhaps ignoring the broader range of issues that were involved in the outbreak. And that's one of the questions that's come up from our audience as well, is how this crisis affected a range of sectors. Because this epidemic caused much more than a public health crisis, and really disrupted a range of aspects, and failure to consider each of these leaves people vulnerable. So I think I'm going to move now to our panelists again for one more round before we try and fit in some final questions. So I'll go first to Rania, and hear her thoughts about both population movement as well as any other urban issues, either ones that I mentioned or any others that you encountered during the response. So over to you, Rania.
Okay. Thank you so much, Leah. And I think actually all of the panelists, Helen and Fernando, and as well as you, we've already covered so many different dimensions. So I will try just to kind of bridge that link around what we did with community engagement, and the linkage also, again, with population movement as well as the quarantine aspects. Because as I mentioned, you know, I think what was really at the core was this trust issue, and building that trust between the health system and people within the community, where they already had people that they already trusted, and being able to manage the fear that was around, that was just looming around during the entire epidemic. So I think one of the things that I'd like to highlight is also that a lot of the time, one of the fears that drove people from also rural areas to urban areas was the stigmatization that would happen in rural communities, especially for people that were infected by the virus, or related to somebody that was infected by the virus. And again, because of how dense the population is, and the urban structures, that people could disappear basically within those urban areas, and they are so dense. And so that linkage between how community engagement and social mobilization also worked with the contact tracing organizations, and how the ministry was able to also coordinate amongst them and the different partners that were working for community engagement, social mobilization, as well as contact tracing, to be able to find and identify people that were possibly infected, or infected others, or try to manage the mobility. So community surveillance, which you already mentioned, and self-monitoring within communities, there were lots of that were set up as the response went on, and there was better coordination, better information, more trust happening because of the different types of stakeholder and influencers that were trusted, that were engaged in the community engagement and social mobilization aspects. There was a better developed community surveillance, and that's why when I started also speaking, I said, the power of community also can't be underestimated. Although it's complex, I think as humanitarians working with government and partners and communities, we have to challenge ourselves and do a little bit better to really understand what were the triggers for action, and what were the drivers for communities, to stay together and be able to stop the transmission, of course, of the virus. So yeah, I think I'll leave it at that. And if there are any questions, that's basically what I wanted to highlight. And maybe just linking that to the last point about what you mentioned about rumors and misinformation, that that kind of community trust then that was therefore built, we were able to address rumors and misinformation much better as the response went on. And there were multiple different types of technologies and tools, and as well as social networks being linked up together to be able to address rumors and misinformation. And as the response went on, that coordination also improved. So I'll leave it at that. Thank you so much.
Great, thanks, Rania. We'll turn next to Helen to reflect on any additional urban lessons you think there are from this response, and also this question that came in around kind of how this crisis affected a range of sectors. If you wanted to touch on that at all, please, Helen, go for it.
As our programs were implemented in both urban and rural areas, we were in a good position to compare how they were different in the two places. Some things we noticed was that providing water was much easier in rural areas because often neighbors could be arranged to bring water in jerry cans, whereas in the urban environments, there was much less social cohesion or perhaps neighborly help in some areas. And if the neighbors don't have water themselves, it's harder to convince them to share. One flat really sticks out in my mind when I visited with our distribution teams as being this multi-story, half-finished building with over 100 people living in it. And then the toilet for the nearby market was on the ground floor of this flat. And the police were trying to quarantine this building. And of course, every time, if anybody else got sick in the building, that would just extend the quarantine for longer and longer. So you can kind of think of the challenges that are involved there. Another experience that sticks out in my mind is when our decontamination teams were traveling behind an ambulance going to remove a dead body from a shack that was just behind a market street, and the problems of crowd control and the security of people who were crossing the cordon, and just general much harder to keep control over the situation. And I think in humanitarian responses we like to plan, and we like in distributions to have our areas all set out, and in a very dense urban environment those kinds of things were just very, very challenging. Also trying to find any locations for burying contaminated items. You might have heard that Freetown ran out of cemetery space and they were having to bring bodies an hour or an hour and a half out of the city, and that also caused issues with local communities over the perceived effects of the activities on nearby water supplies, whereas in the rural areas that wasn't so much of an issue. To touch briefly on the question of the other sectors, I think protection is a very interesting part of the response that was not adequately recognized initially, but as the response went on, people realized how important this was. We've talked already about psychosocial support to patients, also family tracing, including informing families where their loved ones were buried. I think early in the response there were cases of people being buried or taken to hospital and families had no idea where they'd gone, which obviously feeds into that rumor mill and distrust and panic and fear that was quite negative and not helpful. And then ongoing work with orphans and separated children, and work on to reduce stigma for both EVD survivors but also workers, as the members of our decontamination teams, many of them told me that for the time that they worked with us, they weren't allowed to go home to their families, by their families, and would essentially sleep in their cars and then work in this high pressure, high stress, very hot, physically challenging environment all day. So you can imagine the difficulties there. The last one I wanted to touch on is security, and I found that an interesting question because I think for me it was the first time where I saw organizations having to respond to a very different kind of threat or risk to our normal kind of security issues that you might encounter in the field. I think that organizations struggled to deal with the security threat from Ebola, and there were issues around concerns about the availability of medical evacuation, medical treatment in country, quarantine, on return to country, risk to their families, that that made the response quite specific in terms of people's willingness or availability to deploy as well.
Great, thanks, Helen, and thanks for those really rich examples as well. To kind of make sure that we get some questions, I'm going to blend in, Fernando, your comments with one of the other questions that have come in. And I wanted to ask you if you have seen any, innovative activities, anything that you think is a standout example of something that that was new and really was able to address some of the challenges that we've heard around the urban response, as well as any broader reflections you have on urban learning from the response. So we'll go back to Fernando.
Thank you, Leo. I think a good example of the innovative activity that we learned in this response, it took us some time to really build upon it, but we ended up realizing it was the only way, is to build on the self-reliance of the community. It may take longer to explain them, but at the end, it's the only way to be effective. So pretending to come from the Ministry of Health institution, from the security forces, from the government, from the NGOs, UN agencies, all the humanitarian aid, the guys who know what needs to be done, doesn't necessarily ensure the type of response that you're going to need unless you get the buy-in of the community, and that the community can somehow perceive that they can take care of their own people. So I think that was an interesting lesson. And for me, another interesting lesson when it comes to cities, not urban settings, is that the same way that we consider the cities economic hubs or communication hubs for arts, well, when it comes to epidemics and disease, they're also hubs. So the same way they attract people, idea, capitals, business, artists, whatever, they will attract diseases, they will attract bacteria, viruses, or whatever, because that's where people move in and out. So of course it will depend on the type of transmission, but cities are also hubs for diseases. So whenever we see an outbreak, more and more, we have to think that diseases are at high risk, and they don't need to be close or nearby where the epidemic is taking place. It's just because they are cities that they are at risk. So that's something that we need to think carefully the next time we facing this type of epidemics, and don't think that it's only in a far remote geographical area that the outbreak may take place, but it will definitely be easy to involve cities.
Thanks, Fernando. Okay, to keep on going with the questions here, I'm going to go back to Helen and ask for your thoughts on a question that's come in around communication channels in the urban context. Do you have any thoughts on what were the most effective communication channels that you were able to tap into with urban populations in this response?
Sure. Yeah, I mentioned in my first input about the fact that we used SMS surveys. I also found that WhatsApp was pervasive, especially in Freetown, in the urban areas, and that a lot of the rumors and the memes and even the kind of gallows humor Ebola jokes that were circulating were all being moved on WhatsApp, and we quickly realized that that was a very good way to reach people as well in a more positive way, and that the rumors and the stigma could also be combated in those immensely kind of shareable formats that would reach people well. Secondly, I think that radio was really critical, and looking back, I wish that we had realized that sooner, because I think one of the things we never quite got on top of in quarantine was how bored and scared and frustrated people were sitting for weeks and weeks in quarantine with their whole family, and never knowing if someone was going to get sick. And I think that providing radio to people in quarantine would have had a two-pronged benefit of being able to get them good quality messages, but also relieve some of that boredom. I definitely saw a lot of posters, billboards, and paintings on buildings. But I would like to just echo what I think Rania and Fernando have also said, and you as well, Leah, that I think a lot more needed to be understood about who do people trust in terms of the information, because otherwise a lot of the kind of well-intentioned traditional messaging kind of fell on deaf ears. There was such, especially in the early days, such a culture and a feeling of conspiracy and distrust that there was an official Ebola message, but then something else was actually going on, and those rumors were much more, unfortunately, a lot more effective than some of our messaging sometimes. So I think more needed to be done to realize who was it that people trusted and understood. I think some really important stuff happened, especially around engaging religious leaders and traditional healers themselves, and not seeing the traditional healers just as vectors for disease spreading in terms of illicit burials and things, but to actually engage with them as communication channels that people would really trust.
Great. Thanks, Helen. I'm going to turn to Rania as well, both on this one. And also, just to make your life more complicated, Rania, I'm going to throw in another question just because we're running out of time and I want to get in as much as we can. And the questions come in from two people, so I'm going to combine it into one. One is part question, part comment that's come in from one of our colleagues on the line, Linda Poteet, who was also a really key resource when we were putting together these papers. So she'd written about kind of the differences between these different contexts, and that's the core of the question. And I wanted to share some of her reflections before turning back to you, Rania. So Linda has said that while it is hard to compare across the three countries, it's important to highlight the differences in the response. And so there were differences in terms of the approach to quarantine of the different governments, where in Sierra Leone it was led from a more military perspective, with the Ministry of Defense in charge. A security approach to the epidemic really had an impact on how the response unfolded, and she refers to the comments I'd made about people kind of escaping and moving in untraceable ways, and near the end of the response in Sierra Leone, with some families being quarantined in hospitals instead of their homes. She wondered if there'd been any research or anyone knew anything about comparing that idea of kind of having people quarantine at home versus quarantine in a medical facility, which is something that Fernando has suggested is as a possibility, though certainly more challenging when you have such a scale of a urban population. So if anyone does have any thoughts about that, you can certainly share them in. And she also pointed out the differences in each area, each informal settlement and even each kind of neighborhood or sub-area in an informal area or within an urban environment that has its own leadership and needs to be engaged in a different kind of way. So I guess going back to you, Rania, it's both the question of communication channels and also thinking about when you have the outbreak both so different, and also the communities and people so different across even one city or one informal settlement, how you negotiate that. So over to you, Rania.
Thank you so much, Leah. Yeah, no, I'll just add a little bit to what Helen had said, because I think that this is really important. And while there was a lot of visibility of materials, I think that really hitting it on the head and coming back to communities and who communicates in communities was the most critical factor throughout this response, and really trusting the people within the communities as well, because I think exactly what Fernando was talking about, humanitarians or others or government officials thinking that they know better how to interact within the communities and how to build that trust. They needed to actually turn their ear to the communities and understand how to build that trust from that perspective. And I think that speaking on behalf of what happened in Liberia, that really, really evolved quickly, because also how the disease transmission happened within Liberia, everybody was expecting it to be a lot worse. I mean, it was already bad enough. So I think what wound up happening is, as soon as the pulse was put on the community, and it was like, how do we understand community entry a little bit more, the interactions, and that's where we also worked with big organizations that also had networks of community radios, for example, and working with them, building their capacity, just to get the information out, you know, that standard information, or all the information that we all understood that would help people to stop the transmission. What were the behavioral issues? So working with community radios, working with religious leaders was very big. So we actually worked with the large interfaith institutions that had their own networks. So it was more about getting the information out there, the same information to everybody, and then they went through their networks. They took it forward because they had that trust already. Other ones was it was mentioned, the traditional healers, ZOAs, and community leaders, and working with institutions that actually worked with networks of thousands. So during the response in this social mobilization arena and community engagement pillars, working with the government, I think there were mobilizers of in the tens of thousands, and getting the information to them, and then they were taking it directly to the communities because they were the ones already in the communities. And on this also, sharing of information, especially to people that had family that were sick. There were rumor trackers. Actually, UNICEF had worked with this with USAID as well as other partners to set up rumor tracker systems to be able to get information about what were the major rumors, and being able to respond through these different community leaders or community radios, and being able to address what were these issues that were coming out through these rumor trackers. As well as in the Ebola treatment units, later on in the response, there was a tracker system that was set up in which people would be able to receive at least SMS and try to get some information, because that was a huge vacuum. And I think part of the trust building again was that when people would have a family member or a friend or someone they knew going to an Ebola treatment unit, being able to get information, and at least whether the person passed away, have closure that they died, or to know their progress and if they were to be released, so to help their reintegration. And Helen did touch upon that area of, you know, the reintegration and stigmatization, all of that, with people coming back after they were treated and becoming reintegrated and dealing with stigma within communities. So that's on the communication channels part. There were very many, I think, and as the response evolved, they were also strengthened. So in regards to the quarantine issue, I'll speak specifically about Liberia, because I visited actually communities in urban areas as well as rural areas, and from the context, of course, of a humanitarian organization, we are always looking from the rights angle. And I think one of the things that we had to really critically balance was what was the government approach, and how could we best support so that they had the most humane conditions. And I think that was one of the areas that there was a lot of effort from organizations, national organizations, as well as the humanitarian organizations, to ensure that there was some type of coordination to know the needs and be able to support those communities. So in Liberia, in the two communities that I had visited, and they were under quarantine, they were quarantined at home within the in an urban context and at home. So through like very extensive contact tracing and being able to identify the radius, they were quarantined. And of course, again, in urban context, very difficult to manage. But it eventually worked. So, and we have that as lessons learned. So that's it from my side on the quarantine situation in Liberia. But it was very different. It was not military driven. It was very much supported by health ministry as well as partners to be able to ensure that it was a bit more porous. Someone was always checking on a daily basis. So I remember one Saturday afternoon where NGOs that had to provide food did not make their deliveries to a community. and this was immediately reported and dealt with, and even on a weekend, although no one was really having a weekend during that time. But yeah, so there were major issues. I'm not saying that it was perfect at all, but as it went on, there were mechanisms that would be put in place to be able to respond to those issues that would come up a bit faster. Okay, and that's it from my end. Thank you.
Great, thanks, Rania. So we are going to take two more questions and go to Philippe and Fernando for their final thoughts. But as we're getting to the end of the closing time of the webinar, I know that some people might have to go on to their next meeting. So I just wanted to say in advance of those early exiters who have to leave on time, please do fill out the survey that will pop up on your screen and also be sent to you via email. After the webinar. We really do take your feedback into consideration. And also to let you know that we do record a video of each webinar and also produce a transcript, and so those will be shared with you in the coming weeks. So if you missed the last bit, you can catch up, and you can also share it with any colleagues. And finally, that any questions we didn't answer we'll be putting into the Urban Response Community of Practice, so please do follow on there. So I'll turn to Philippe for our second to last question. Because I think we have to really take advantage of having UN Habitat's expertise on the line and turn this one to you, which is there's a question around whether the Ebola response in West Africa showed a need for improved urban planning, or what that could have perhaps brought to a crisis like this if we were able to do that better before and after crisis in environments such as these cities that were affected in West Africa. So over to you.
No, thanks for that, Leah. And I think we underestimate the impact of informality and people living in slums. We pointed to the issue of density, lack of sanitation. We pointed to the challenge of because informality means outside the formal system. So the challenge of these people also being not part of normal discussions, not being asked for their advice or their ideas, and so the lack of trust. The trust issues were major in the case of Liberia, but I would say are in all urban settings. Now the challenge, of course, is that this is about managing urban growth and maximizing the amount of people that are part of the formal city, the formally planned city, the formally serviced city. And often exactly this is necessary at moments when urbanization is accelerating, and at the end again of the Civil War, when people were flocking to the cities, there was no capacity to plan. So we do need to think through how we can manage urban growth, specifically when there's a big influx of population, because that's the moment when it needs to happen. The new urban agenda, which is the new global agenda on urbanization, agreed in Quito last year, gives some guidance, but it's clear it's a major challenge. But I would argue it is fundamental in ensuring better preparedness for these kind of problems going forward. And again, it's the kind of issues that fortunately will come back to haunt us. And hopefully we'll take the lessons from it and make sure we do plan our urban growth in these kind of situations. Over.
Great, thanks, Philippe. So our final question, I'm going to turn to Fernando in a moment. Our final question is really reflecting on all the discussion we've had today. Fernando, do you have any thoughts on what practical things we can really do to put these lessons from the Ebola response in West Africa, which is thankfully now, long over, but crises like these are not. We have the cholera outbreak in Yemen. We have other crises certainly affected by things like population movement across the Middle East and elsewhere, and there will be undoubtedly future urban responses where all of these issues come up. So, how do we, what do we take forward in terms of practical things we can do to make sure that this learning is taken forward? Over to you, Fernando.
Okay, and we're going to see more and more of it coming, because when the population is moving to the cities, we'll have a more and more higher percentage of people living in cities. So yes, we're going to see more of that coming. I think from Ebola there were a lot of lessons learned exercises by a lot of organizations, WHO. I mean, we conducted our own one within the European Union institutions. So there have been those exercises done. I think it was one of the big crises where a lot of people took a bit of reflection after that. And in the meantime, as a community, I think what is very relevant is that we document all those lessons learned, but all those documents. I mean, I think your documents are a very good example of what could be useful in future crises, because people could go and look at them and read them and already take conclusions and examples and see, be able to learn faster on how to respond. I mean, it took us some time to be able to react and to learn from this crisis. Hopefully, we should be getting better and better for the new crises to come, which they definitely will also take place in cities. So I think that documenting them is a good step forward. And making them available online.
Great, thank you. Well, thanks for that final plug, Fernando. It's great. I didn't have to be the one to mention the papers and also the COP, which, although the Ebola in Cities group is no longer the Urban Response Community of Practice, is still there. And I think, I think also there's a responsibility for each of us to take this learning as we go forward into future responses and to refer back to these examples. There's certainly a wealth of them shared by the panelists today, and I know that you in the audience out there have a wealth of your own experiences and knowledge, and I think it's on our shoulders to take that forward as well and to share those examples with people when we see these things in future. To end, I guess I really hope you found this as useful and interesting as I have, listening to us over the last hour and a half, because I think the issues that we covered here are really not unique to this Ebola response. Finding ways to engage with the municipalities, with dealing with dense and mobile populations, pre-existing vulnerabilities, and informal settlements, and all the other issues we've spoken about really do come up in all sorts of urban responses, and no doubtedly will in the future. We had so many questions come in that we weren't able to get to. Questions about engaging with faith communities, engaging with different types of local communities, dealing with reproductive health, all sorts of questions that have come up, and we just didn't quite make it to them. So we'll be putting together a list of those we didn't get to and putting those into the Urban Response Community of Practice as well. And so please do get in touch if you're not already in the Urban Response COP, and we'll make sure that that you can get on that if you're not already there. So thanks again for everyone for joining us. Huge thanks to our panelists as well as Philippe for sharing their insights today, as well as all of the 30 or so colleagues who shared their experiences with us while we were working on these papers. Thanks to my colleagues here at ALNAP, Maria and Alex, who've been behind the scenes making sure that this webinar ran smoothly, as well as all of you, our faithful listeners, particularly those of you who've stuck it out with us even 5 minutes over time. Thank you again for joining us, and we look forward to seeing you at the next Urban webinar. Have a great day.